You're tuned to The Weekend, a weekly public affairs show which airs every Saturday right here on KTEP. Good afternoon. I'm Louie, your host for The Weekend, and join us today are Reyna Puentes and Patricia Juarez, and they're here to talk about Alcohol Awareness Month, but also talking about a program that's here on campus. In case you didn't know anything about it, they're here to tell us about what they're all about and some of the events that are happening in April. They represent the LAHDR, and that stands for something, but I'll let them explain it because it's a tongue twister for me anyway. But I'm glad that they joined us this morning. Reyna and Patricia, thank you so much for being with us here today.
Thank you for having us.
So as I mentioned, LAHDR, tell us a little bit about that.
So this stands for the Latino Alcohol and Health Disparities Research Center. And we work at the psychology department, and we are focusing on research, but our main thing we're here to talk about is our training work. And basically, we trained different kinds of providers, healthcare providers, mental health providers, in evidence-based practices, primarily based on motivational interviewing. And these are interventions that have been shown effective to promote health-related behaviors and also to decrease health risk behaviors, anything from alcohol misuse, substance abuse, health habits such as eating, such as exercise, also medication compliance, program compliance when we talk about maybe probation and the legal system, and also treatment compliance when we talk about mental health.
As far as the center itself, how long have you all been on campus?
The center, I think it's going to be 6 years that our center director founded it. And our center director is Dr. Craig Field.
Is it in any way linked to a national organization that you all are aware of?
So we are kind of new at this, but we are based on nationally recommended practices. So as Pati mentioned, all of the stuff that we train in are evidence-based practices. And what that means is they've been recognized by the World Health Organization or the National Institutes of Health in terms of there being like research investigations and clinical studies that prove and demonstrate the efficacy of these brief interventions in terms of promoting long-lasting behavior change in clients. And so we really take the expert work that's already been done out there, and we're trying to bring it to the community because at least in El Paso, we are, if not the only training center that's actually providing this sort of training to communities out there. And so that's kind of what we want to do and our contribution to our community.
As far as alcohol use or alcohol abuse goes, is there a study that is linked directly to minorities and Hispanics? I think, if I remember correctly, when I interviewed Dr. Field a few months ago, he talked a little bit about how males are especially at risk for doing something like this.
Yeah, definitely. You hit it on the spot. Dr. Craig Field has previous experience in doing these clinical investigations to test the efficacy of brief motivational interventions among like a hospital population. So just anyone who would be walking through the doors of a hospital, either to the emergency room or admitted to the hospital. And what they found was that particularly among Latino men, there's higher rates of alcohol misuse. And so through these interventions, targeting that population, we're able to kind of, first of all, better understand the patterns of drinking among Latino men, and then be able to help them address the issues that they're facing specific to their experiences. So especially of concern to our border region, we know that there's people that maybe don't have health insurance. We know there's people that might be afraid to go to the doctor due to immigration status. And so what we're trying to do through providing training in these evidence-based practices is get everyone trained, even community health workers or promotoras, people that work at the consulate, to be able to have these everyday conversations with people without actually having to have them go to the hospital or to their primary healthcare provider, which we also know a lot of people in our community don't go to their primary healthcare provider. They actually go to the emergency room as their primary health visit. And so not only is that really costly to our community, but they also might not be getting the best sort of care and treatment. So we really want to take advantage of those small opportunities to provide this training so that people can be more effective in generating these changes.
So, Patricia, if you wouldn't mind sharing with us a little bit about some of these talks that you're giving, not just here on campus, but you were in Las Cruces last week, New Mexico State. and you're dealing with people and letting them know what your research has shown, what you all are looking for. Tell us about what people can expect here in the community.
Well, as our name says it, our primary focus has been on addressing the public health concern that alcohol represents to our communities. And so we're focusing on building awareness, first of all, in people getting to know the science, the facts behind alcohol. That's some of the talks we have done directly to the public, so that they can, hopefully with this information, make more informed and safer decisions around how they use alcohol. Now, on the other side, we're also providing these trainings, as we were saying, to community and healthcare providers so that they can have these conversations in a way that they can talk to people so that they can consider making changes in the way that they drink and the risks they might be exposing themselves due to how they're drinking.
And what are some of those possible changes that may be coming about?
It's a range. So people can start from reducing their risk-taking, mainly around drinking and driving, for example. They can decide to moderate their use and cut back and maybe drink within certain low-risk limits that are recommended by the National Institutes of Health. Or they can maybe, based on their own experience, decide that probably the best idea would be to quit completely. And again, that's a decision that providers with this training that we offer would be able to facilitate having the person make up, their choice about what's best for them in terms of those options.
Reyna, we live very much in a social media world. And, some of the things that people ask now is not, do you have a phone? Do you have a mailing address? No, they'll ask you if you have a Facebook account or anything like that. And we've seen some of those posts on social media where it's almost like they're reaching out to people and saying, hey, try this, take a drink. Look how great it is. And we've seen commercials, especially during football games, a thing like that. It's you see some good-looking men with some good-looking women, and the message that sort of comes out is if you drink this, you're going to attract beautiful people.
Yeah. Unfortunately, we do live in a very much marketing-driven world, and we've seen that from years of studies in tobacco. So that's one of the first kind of targeted behaviors that health companies were out there trying to better understand and get rid of those messages that are often misleading. So one thing is what they're presenting in pictures, but what they're not presenting is the consequences that go through with that. And so most of the time people think the only consequence they can get from drinking is a DWI, which is not only, really the case. We know that these health problems can range from, even if it's just feeling a little hungover the next day and going to work or going to school and maybe not being 100% like at your full capacity, or even having problems with, your loved ones, your boyfriend, your girlfriend, your husband, your wife, problems at work maybe, even health problems. We know that alcohol is associated with at least 72 medical conditions, meaning it actually causes them or it makes them worse if they're already there. And so this is a lot of the messages that those media and social media are not going to go out there and show you because, well, they want you to buy a product. And we understand that. We know that alcohol is the most commonly accessible drug out there in the community, and it's also the most commonly misused drug out there in the community. And so we really want to kind of raise awareness of this other side of the picture in a non-judgmental way. We don't want people to think that just because you're talking to your healthcare provider about alcohol that we're going to think you're an alcoholic. That's really no longer the case. We're really kind of working with this population who are drinking at high-risk levels, which are putting them at risk for experiencing these types of problems that I just mentioned without necessarily meeting the criteria for having alcohol dependence or alcoholism. So we really don't want those high-risk drinkers to go undetected anymore. We really want to be able to identify them and facilitate these conversations just to become aware of the types of consequences that you might be experiencing related to the way you drink.
And I'm glad that you brought up the fact about problems with family or with relatives, wife, husband, etc. Because in an interview we did, this was several years back, but one of the police officers that we interviewed talked about how the Super Bowl weekend was one of the highest days as far as calls for domestic abuse and violence because the team that somebody chose didn't win or because they had too many drinks, and then as a result, it's the innocent people who end up getting hurt.
We know that alcohol, one of its main effects is that it inhibits good decision making. And so people at certain levels of intoxication start making decisions or taking risks in terms of, as we mentioned, driving. As we mentioned, they could tend to get more violent and engage in physical fights. A lot of crimes are committed under the influence. We know it's also related to sexual risk-taking and all of the other things associated with it, like STDs, unwanted pregnancies. You're more likely to be assaulted if you're under the influence, or, people who commit sexual assaults, it's more likely that they will be under the influence. So kind of alcohol gives you this liquid courage kind of thing that leads you to take risks or do things that you wouldn't do otherwise.
We are visiting with Reyna Puente and Patricia Juarez, and they're with the Latino Alcohol and Health Disparities Research Center here on campus, talking about reducing alcohol use, some of the health disparities, as Patricia just mentioned, but also some of the presentations that they're going to be doing on campus, and they're available to speak to your group or organization if you want to hear more about that. So having said that, Reyna, I'll move it over to you now, and if you wouldn't mind telling us about some of those things that are mentioned in the flyer that I just saw.
Yeah, sure. So we're here to kind of spread the word about this training that we're providing to the community. It's a free training of 21 hours of evidence-based practices, which means we're training healthcare providers, students, pretty much anyone out there who is in the setting of talking with people or is looking to be in that working profession. We're training them in brief motivational interventions to address alcohol misuse. And so what we know through research is that going to just one of these trainings, like 4 hours or 8 hours, is not really enough to get people up to the confidence level of being able to actually have these conversations with clients. So that's why we've put together this training series. Our training series starts on April 17th, and it runs through June 27th. And like I said, it's a breakdown of up to 21 hours of training in which we'll not only be presenting some of the stats and facts that we know, but we're going to be focusing on getting providers or people who attend this training to really practice this conversation. We give them role plays, real plays. We give them feedback in the training so that they can learn what to do more of and what to do less of in their conversations so that their clients feel much more likely to consider making any small sort of change in their drinking, which eventually we know a small change now will turn into a larger change down the road if it's motivated and impacted in the way that we know motivational interviewing and brief interventions do work. So that's why we really focus on giving these trainees, people who sign up for this training series, the best quality training, coaching, and feedback so that they can feel confident when they go back to their offices to have these conversations with clients.
So this is something that if they attend one of your informational sessions and they are trained and enrolled in one of these, does that qualify them pretty much to go back and say it's somebody from HR? They can then have a meeting with workers to talk about some of those things, or is this more one-on-one?
It's definitely something that can go in their CV and in their repertoire of tools that they can bring upon their jobs. We don't provide any certification necessarily. That's a longer process. But, this model offers the essentials of what research supports training should be like in order to get providers to actually start implementing some of these skills and actually have an impact in their client outcomes. Now, it is important to say that, as we mentioned at the beginning, this is an evidence-based practice. Although we are going to be focusing on having the alcohol conversations in this training series, once providers learn it well in one particular behavior, we know that they can generalize it to other kind of behaviors that they may need to have conversations about with their clients, being either health habits or, as I mentioned, medical adherence, program compliance, any other things, as you learn it well with one thing, you can start having all sorts of conversations with regards to positive change.
We're visiting with Reyna Puente and Patricia Juarez from the Latino Alcohol and Health Disparities Research Center here on campus. Reyna, as far as problems with alcohol and direct usage, being the fact that we're here on campus, what has your research shown you, or what are you looking at as far as young people using alcohol?
Yeah, so we know that the college scene is often very closely tied with the idea of drinking, especially because people become of age, they turn 21, or there's like tailgates and there's all these bars around that are close to school. And so people often associate college with drinking. Now, at UTEP, we're kind of in a special case because we don't have a lot of that, like fraternities or sororities that live in the houses, and we know that that's also a huge risk factor for binge drinking, being associated with a fraternity or with a sorority. They're much more likely to engage in harmful drinking. But what we do also know is that because we do live so close to Juarez, that sometimes people who are under 21 oftentimes go over there to be drinking where the legal age is 18, and they're coming back and still causing these sorts of issues or problems in our community. And so what we're trying to do is kind of reduce the stigma of what alcohol problems mean and have people just become a little bit more conscious and aware of the problems that this can have. Now, when we talk about problems, oftentimes people say, well, I'm not experiencing problems. I'm young. Everyone's doing it. But what we do know is that over a period of time, exposing yourself to this type of drinking, say you drink on a Friday and Saturday, you drink every weekend during the 4 or 5 years you're in college, that's a lot of weekends. And by the time that you get out of college, it's a lot harder to let go of these habits that you kind of picked up during college. And because alcohol becomes more accessible, because you're out there making money now and you have your own money, you kind of start taking it to the next level. And so we're really in a great opportunity here during college time to give people this awareness and have them kind of get an idea of what their life could look like in the future if they don't make the necessary changes now.
What does research show about risks being generational? Perhaps if someone in your family was an alcoholic, and is that passed on down from generation to generation?
There's definitely some genetic predispositions that get inherited like that, but there's also what the modeling and how you see people around you use alcohol to cope or use, in like traditions. And so it's a combination of factors, but there's definitely a predisposition to a higher risk for developing alcohol dependence.
And does it change at all for male, female, gender differences?
Well, really what we know from modeling behavior is that whether you're seeing your dad do it or you're seeing your mom do it, you're more likely to do it. And we do know also that women maybe sometimes are less likely to come out and talk to their healthcare provider, talk to their doctors about it because there's more stigma associated with that you should be in the role of a woman, that you should be taking care of the home. And so we're trying to also bring that to light and understanding that everyone is at risk, especially if you see it in the home or, at the birthday parties, at the baptisms, at the quinceañeras. It seems like it's a cultural thing all around. And what we're really trying to do is kind of break that misconception, have people really understand that it is an issue, even though it's present and very relevant, it's still an issue.
You mentioned earlier about, drinking on weekends while you're in college and the fact that if you're at, 4-year institution, those are a lot of weekends. And some people might say, well, I have a drink on Saturdays or I have a drink on Fridays, but I'm okay. I can handle it. And after a while, they become what some people have referred to as, quote, functioning alcoholics. Can you define that, please?
Well, it depends on the amount and frequency that they're drinking. We know from the National Institutes of Health that there's those limits that are the recommendations that once people cross them, regardless of how higher they cross them, they're exposing themselves to higher risks for, the problems that Reyna was mentioning earlier. So, for example, for men, when they exceed 4 drinks on a single occasion or when they exceed more than 14 drinks per week, that's already putting them at the category of high-risk drinking. So, of course, the more you drink, the more the risk. But, once you cross that limit, the idea is like you're exposing yourselves to health problems or family, the risks for family problems or for job, school performance. So that starts increasing the more you drink above that. For women is anything more than 3 drinks on a single occasion or any more than 7 drinks on a week. So it's just something to keep in mind that once you go over those, you might be considered a high-risk drinker.
We're visiting with Reyna Puente and Patricia Juarez with the Latino Alcohol and Health Disparities Research Center here on campus. Ladies, as far as You talked a little bit about gender issues and how it affects male or female. What about the ethnicity? Are there any studies that show that a certain ethnic group is more prone to go in that direction?
Yeah, so among college students, we know that if the white population is more likely to engage in binge drinking, but really in the community as a whole, we do know that Hispanics are more likely to engage in this binge drinking. What's of particular concern here is the health disparity aspect of it, kind of as we mentioned earlier. Sometimes Hispanics are less likely to have health insurance, less likely to have a healthcare provider. And so while the rates of drinking are kind of up there, we do know that their access to care or their access to treatment is underserved. And that's where the health disparity comes into play. And so that's another thing to keep in mind when you're talking with these culture groups. Another thing to keep in mind is that motivational interviewing has been found to be effective around the world. So it's an international approach that has been found to be effective in over 50 languages. So that means that there is something about this approach that we're providing training in that crosses the barriers of culture. It allows you to connect with a person, no matter if your culture is different than theirs, because it allows you to understand from their perspective in a non-judgmental view what their experiences are like with alcohol. And so that's kind of why we're providing this training in brief motivational interventions, because we know through research that this type of conversation, when it's done right, can cross those barriers and can really tap into what's most important to the person. One thing that's common across all cultures is values. And so there are values that people have that are underlying, hopefully, their every step that they take in their life to try to bring them closer to what they value. And motivational interviewing taps into that. And so I think that's why this conversation has been found so effective across so many culture groups.
Our listeners might be right now listening and saying, what do you mean by motivational speaking? Am I going to go in there and motivate them not to drink? And so what kind of motivational speaking, can you give us an example is what I'm asking.
Well, in its most basic terms, motivational interviewing is a way to establish conversations in a way that people convince themselves of making changes, hopefully in the direction of their well-being. That's the goal. So you use these basic clinical tools to help people think about and verbalize, like, what are the reasons why they might want to consider a change? What would be the benefits of doing so? What would be the concerns of continuing with the behavior? And so the idea is that you have people thinking through these things and ideally verbalizing their own reasons and argument for change. And we know, again, from the investigations that the more people verbalize that, the more commitment and the more long-lasting change comes out of those conversations.
Yeah. So we pretty much train providers to have an ear, a listening ear, and a focus on this particular type of language that comes from clients that indicates, I'm thinking about it. I could possibly consider it. And so oftentimes providers are focused on the negative, on why isn't this person changing? Why do they keep drinking? And that, we have known through research, isn't very effective in terms of motivating people to believe that they can make a change. So what we do is we focus on training these healthcare providers on being very strategic and targeting their questions, the types of responses they have in a conversation, so that a person becomes to kind of convince themselves through their own arguments, their own reasons that they are saying out loud. And research has shown that too, that a person is more likely to convince themselves of what they hear themselves saying rather than what I'm hearing my healthcare provider tell me. So it's a very kind of different conversation in which the client is going to be the one telling you why they might want to make a change and why they think they could do it. And then, of course, the healthcare provider can come in at the end and offer some helpful tips, some recommendations, or some other information. But first, we really want to give clients the chance to speak for themselves and hear themselves say the reasons why they might want to consider a change. And that's what we know through research is what leads to long-lasting behavior change, because when they leave the doctor's office, they'll be able to take those reasons with them. And it's going to stick with them much more than having someone tell you what your reasons should be.
And what you just mentioned brings up something very important, because families can definitely play a role in this, but it works both ways, because there could be the one who is very motivational, saying, do this for your family, your children, they're counting on you. And then the other side would be, you're just like your father. Look at you. Or you look like your grandfather. Look at you. And so they get attacked from both ways. And they go out, and then all of a sudden they're with their peers, and the peers said, don't worry about it. Come on, let's do this and do that. And so that person is receiving mixed messages. And I guess what you guys are all doing, the fact that you're reaching out and saying, no, this is the proper way to do it, and here are some examples that this works.
Yeah, we do know that motivation is dynamic, meaning that it can be influenced by the person I'm talking to in the moment. So I could be talking to my buddies and being really motivated to go to happy hour or go to the bar tonight. But then I can maybe go talk to someone who might be asking me the right types of questions that might make me want to consider the moves I'm about to make that weekend. And so what we know is that the interaction between you and I can really impact a person's motivation. Now, exactly as you said, we can either impact the motivation negatively to make them want to go out and drink, or we can impact their motivation positively to make them want to consider a change. And so that's how we know to be strategic, to have people have this ear out and really guide the conversation in the right direction, so that the person ends up feeling highly motivated and confident in being able to stick with their decisions. Even if it's a small change, that's a good change to be considering. And so that's what the focus of our training series is about.
So, Reyna and Patricia, if you wouldn't mind sharing with us, you already told us that it's going to start April, and it's going to continue through June, April 17th through June 27th. If you wouldn't mind sharing with us perhaps some of the highlights of the upcoming things and where people can go to find out additional information on dates and times.
Yeah, so we will be offering, like we said, 21 hours of training that span through the dates of April 17th through June 27th. And this is a training series, meaning that each event in the training series builds upon the last one. So you kind of commit yourself to receiving the full 21 hours of training. And what you'll get is a really targeted teaching and learning on how to have this brief motivational intervention to address alcohol use. Now, after this training series, we do support learners to take this conversation to other target behaviors that we know are faced out there in the community, the ones that Pati mentioned earlier. And so you get that support from us after that. We also offer continuing education credits for LPCs, LLSWs, for LCDCs, and even peer recovery coaches. So that is an added incentive for people to come and learn this skill. If you want more information, you can go to our website. That's utep.edu/LAHDR/SBMI. So that website will take you to the registration page where you can read more about this. You can find the training dates on there, and you can actually go ahead and register and sign up. You can save your seat. We're expecting 50 people to join us for this training, and we're already about halfway full. So the quicker that you get out there and register your seat, the better it is. And feel free to share that with anyone who you think might also benefit from receiving this type of training. You can call us at 747-6337. That's our direct extension. And you can also send us an email. That's kind of the better way to get a hold of us so that we can be sure to get back to you as soon as we see that email. Our email is lahdr@utep.edu. Any email that you send through there, we'll get back to you within a day and be sure to have your questions answered.
Well, we want to thank you both very much for taking the time to be with us here today. We really enjoyed it. Thank you.
Thank you.
We were visiting with Reyna Puente and Patricia Juarez. They are with the Latino Alcohol and Health Disparities Research Center here on campus. Thank you again for being with us.
Thanks.
The Weekend is taped and produced at the KTEP studios, University of